Everybody, this is Dale. I see Julia is starting to do some work with the display. And Julia, whenever you're ready, we'll go ahead and get started.
Okay, one moment. Oh wait, we can go ahead and get started.
Okay. Well, to respect everybody's time, I know it's been a full day of meetings for most of you. I wanted to welcome you to the PACES meeting. This is our third meeting post reorganization. And I think we probably should start out with a roll call. Shelley, will you do that? And now that we're, I think, formally structured, we're going to be looking for quorum. But as we are an open meeting, I'm really happy to see the attendance that we have. For those of you on the phone, well, everybody's on the phone, that your name's not listed, maybe you can do a shout out and let us know who you are. Shelley, you want to start that?
Yeah, this is Julia. I'll go ahead and do a roll call. So Don Darling.
I'm here.
Awesome. Dr. Woolridge, you're on the line. RJ Dieters.
I am here, thank you.
Perfect. Jordana Carpenter.
I am here.
Yep. Gretchen Lurch. Nikki Kovac.
I'm here. Oops, Nikki's here.
Okay, thank you. Heather Miller.
I'm on the phone.
Thank you. Jacqueline Evans.
I'm here.
Tony Huma. Okay, Ann Stafford, I think, Ann Stafford, I think, will not be able to join us today. Neither will Chris Ramos or Debbie Johnston. Julie Augenstein. Okay. Okay, Teresa Enner, assuming she's not able to join us. Kathy Lewandowski. Okay. Allison. Okay, and then Dr. Bradley is in the room with us. Awesome. Okay. Let's see. 1, 2, 3, 4, 5, 6, 7. Yeah, we have exactly 7. So thank you to those who are on the call. Just a reminder, if you're not speaking, could you please mute your phone lines?
Anybody on the phone want to give a shout out, or maybe you can chat in the name, your name that you're here. That'll help us in the minutes. Likewise, since we're all on the phone, if you would announce yourself when making a comment, and that will also help us with the minutes.
This is Gretchen Lurch. I'm calling in from Flagstaff Medical Center.
Awesome. Thanks, Gretchen.
Hey, this is Jeff Marcus from Timber Mesa Fire.
Hi, this is Rebecca Haro from Sun City Fire and Medical.
This is Teresa Salama from Northern Arizona EMS Council.
Kim Choppy from Valley Wise Health.
Rod Reed with the Western Region.
Okay, does anybody else want to introduce themselves or move on?
Okay, Julia, may I?
Yes.
All right, great. Displayed in front of you is our agenda items that will go in order. My name is Dale Woolridge. I'll be chairing the meeting, and I welcome you all. As I had mentioned briefly before, this is our third meeting after our restructuring under the Bureau. The Bureau, I think, wisely wanted to create a formal membership to the committee. We are non-statutory, but we will be voting intermittently on different elements in the work that we do. I think also wisely, we wanted to maintain the spirit of openness to the PACES committee meetings and having it open to everybody's input. So we'll be maintaining that as we go forward also. Thank you, Julia. She's displaying a roster as far as members for the committee. I think you'll see that it's widely represented. We really wanted to capture Arizona globally with both the regions, interested parties, stakeholders, healthy inclusion of rural areas, and some of our critical access sites.
I would also like to, can I just interject really quickly, Dale? Since obviously, because this is only our third meeting, we have several new members. So I think we can welcome Dawn Darling as our nurse with emergency pediatric experience, RJ Dieters as our EMT, Jordana Carpenter as our family representative, Gretchen from NAMES, and then Mickey from AIMS, and Jackie from SAMES. So welcome, everybody. Thank you for joining the group.
Thank you.
Thanks, Julia.
Thank you for that. So for those of you who were in our last group meeting, we had started talking about one of the new tasks that we wanted to put in front of the committee, and created a small breakout group for that. And that was in regards to creating safe sleep education. And Julia is showing some of the slides we have here. This is in draft. And as our meetings go forward to polish this, it'll eventually go to the full committee for feedback for all of those who would be interested in giving input towards this. The premise to the concept was summarized again in prior meeting, that a significant number of child fatality in Arizona is related to unsafe sleep environments. And part of a national movement, and that we wanted to bring to Arizona, was the capability to utilize pre-hospital personnel to disseminate education on appropriate sleeping. And this is on-site education that could be prompted by a visit to a home and or outreach related programs. The product, we're hoping, once it goes through the process of approval through education and EMS Council, would be available through Department of Health to the outside agencies as a free product that could be turned around and disseminated, or turned around and even offered as CE or even Arizona Post credits. So this is kind of our first plan as we're going through that. And I would encourage everyone on the call to help us in creating this tool for our paramedics and EMS agencies in the field. Julia, did you want to show some of this briefly, or should we wait until it's better fine-tuned? Julia, are you on mute?
Yes, sorry. Yes, let's go through it. Just so everyone knows, Ann Stafford was listed on our agenda as doing a presentation about the PPEC program. She had a family emergency come up, so she won't be able to join us. So the meeting will probably be fairly short, but I'm sure that's good news for everybody with everything that's going on. But yes, let's go through some of the slides. Dale, if you kind of want to take the lead, I can just kind of move through them.
Sure. So visual concept, I think in the first slide, that of being a baby sleeping, and a later cue for what's right or what's wrong about this. So safe sleeping, the back to sleep campaign, should babies be sleeping on their stomach? So maybe we should modify that one with a little slash across it, I think, at some point. Tummy time is good, right? Next slide for the objectives. This is really written for the first responders. In the EMS environment, we want people to understand the role suffocation plays in infant sleep-related deaths. It's almost universal in deaths under 1 year of age. That SUID's cases are associated with unsafe sleep environment. It's pretty remarkable data if you haven't seen it. Be comfortable with the knowledge and be able to give that guidance to family members as you have an opportunity to. When on site, you can evaluate unsafe sleep environments and be able to offer that education. Offer education about better practices and refer individuals to further resources. And again, we're looking to create kind of a toolkit packet that would be complete with potential handouts and web links that family members could use to gain further information. Next slide. Is to essentially go through those objectives. Some of the data regarding the statistics, you can move a little bit faster, Julie, if you don't mind. About suffocation, this all comes from the Child Fatality Review Report. We gave the most recent data in 2019. The high association with SUIDs. Next slide. And again, it's pretty remarkable. So the death rate in children is often remarkable. Some of the statistics, moving on, and that these are universally preventable. And I think this really dovetails with what one of our missions are as far as first responders and EMS personnel are concerned, is that these deaths can be prevented universally. Keep going. And then some of the techniques, we like to not co-bed. Sleeping is fine if they're not in the same bed with you. Have them next to you. So don't share a bed. Don't clutter your bassinet. No sleeping on the side or stomach. An unsafe sleeping surface. Any bundled clothings, heavy blankets or comforters. And then obviously good advice, ways to put children to sleep, and then best use sleep environments. Share the room, not a bed. Using their own sleeping surface on their back. And then obviously avoiding the suffocation component. And then your role as the EMS provider to evaluate the scene, to relay information, and refer them. So again, very much dovetails with that concept of service in the community, and even dovetails with treat and refer strategies. And that's coming towards the end of our slide set. As far as the CE component to this, it needs to be somewhat interactive. So we wanted to add maybe kind of an image set of do's and don'ts, and then maybe even some questions afterwards for knowledge retention. And that was kind of our project where we have it next. Julie will be announcing when we have our next work meeting to work on this slide set. And I would encourage you, and I hope all of you can attend and help us with that. Any questions about the tool so far? All right.
Okay, I don't think we have any questions.
I do have a question. This is Kim Chappie.
Sure.
Is the group working with Yomi from the state for the Safe Sleep Task Force? From some of the work that they've done?
Yes. So we're working with Yomi from Injury Prevention and then Ann Stafford from AAP, who are both part of that group.
And
Okay, thank you.
yeah, Kim, great question, because the last thing we want to do is reinvent the wheel, because there's been so much work that's been taken out as far as public health related issues, to the clinics, to the school districts regarding this. Um, it's a newer campaign to actually apply this as an intervention in the EMS community. There's a couple of state models that we're planning to model over after. There's a program out of Florida and Ohio that are pretty robust. So yeah, we don't want to reinvent the wheel. So if there's any other partners that you feel need to, who could offer assistance and are willing to, we'd be more than welcome to have anyone else involved too.
Okay, thank you.
All right, there's no more questions about that. Again, keep your eye out for when Julia releases our next work group meeting. We'll go into the next item in our agenda, the timeline for rulemaking. That's been updated. Is Terry or anyone else from the Bureau who can present that on the line?
Broadly, so there's a document on the the Bureau's website. The Bureau's website can sometimes be a little difficult to navigate, but if you find your way to the department's website and can find the Emergency Medical Services website on the left-hand side, there is a link that says regulatory references. There's a PDF document that's kind of a crosswalk that currently has a tentative date and then a plan for when that's going to go into effect for the plan. Sorry, Shelley, I got to.
So Ben had to step out, but essentially, if you're interested in the rulemaking updates, I think the timeline has been changed a little bit. We can send that information out, or it can be found on our webpage. And then I think the last thing, we can move on to the next thing on the chair notes, Dale.
Okay. The parliamentary process, I'm a little bit rusty with, so forgive me if I announce these incorrectly, but we do need to review our past minutes. I think, Julie, if you wouldn't mind, if you have them available to display, or if everybody had an opportunity to look at them before attending the meeting.
Yes, I'm sorry. I think that's moving down a little bit. I just have a couple of quick updates for the Bureau report before we get to that point.
Oh, okay.
All right. Sorry about the confusion.
No, I may be looking at a different draft of the minutes, or I mean of the agenda. So you go ahead.
No worries. Okay. So just a couple of updates. First of all, if you see on the agenda, I mentioned the National EMS Data Analysis Resource Center data collection survey. So if you were at the last meeting, I had mentioned this, but basically what this is that the National EMSC program is doing data collection right now. So if you work for an EMS agency, you should have received a survey email from me, or somebody at your agency should have. Just kind of asking a couple of questions. It's focusing on the Pediatric Emergency Care Coordinator performance measure, as well as pediatric equipment. So currently we have 104 agencies that have completed that survey. So that survey does close at the end of this month. So we'll probably do one last push through a couple of phone calls to see how many agencies we can get to complete that. But that is a big jump up from last time the survey was done in, I think, 2017, 2018, where we had around 69 surveys completed. So that's great. Hopefully, I'm not sure when we'll have the results of that back, but when we do receive the results, I'll be able to share that with you all. And then kind of related to that, the National Pediatric Readiness Assessment is a similar survey of emergency departments. So if you're unfamiliar with that, that would be kind of surveying emergency departments to see how pediatric prepared they are. It was previously scheduled to begin this June. I'm not sure with all of the COVID-19 stuff going on, if that will continue with the same timeline, but I will keep you updated on that. And hopefully we can I'll get a plan together on how we can kind of disperse that information out to the emergency department. And lastly, I think David McCarthy is actually on the line, so we'll have more information to share about this at the end. But actually, David, why don't you say what you have to say right now about the Western Regional Alliance for Pediatric Emergency Care. This is something that's kind of that I've been participating in, and they are looking for additional volunteers. So David, if you want to go ahead and speak.
So yeah, I actually had two things to talk about in regards to pediatric surge. I'm David McCarthy. I work with hospitals and healthcare and emergency management preparedness. And I'm working on two projects. First, I'll talk about RAPM. RAPM is a 5-state the Western Regional Alliance of Pediatric Emergency Management that is being funded under a federal grant and headed out of UCSF in California. And its a primary focus is around, of course, pediatrics, but in disaster. And much of what a good portion of that is looking at how do we move and transfer patients around and redistribute them when hospitals would get overloaded, including if the need to facilitate transfer across state lines. And also another element related to overall preparedness. So Julia's been participating in the EMSC focus group under that RAPM project. Did you want me to just go ahead and talk about the Arizona piece too, Julia?
Sure, that's fine.
So in addition to that, I'm working with ASCHAIR, the Arizona Coalition for Healthcare Preparedness, in terms of developing what's required under the healthcare preparedness program for this year is a pediatric surge annex, an annex to the coalition's response plan. And I just wanted to communicate about that, and then look for an opportunity for both for RAPM and also in this pediatric surge planning effort input from the EMS world, particularly around ability to transport and transfer pediatric patients, more, a little more specifically than adult patients. So those are those things that are going on right now, of course, corresponding with COVID and everything else to get done by June. Would there be any questions? I also have, Julia, if it's possible for me to share a screen, I do have a couple of things that I can just show. So I just use the share button here? Or do you have to unshare first?
Shelly will pass you the ball, and then you can share your screen.
Okay. Pass me the ball. Okay. And then I just use that share button?
Yep.
Okay. So, the first thing you're seeing is we're basing the pediatric surge annex on the Asper Tracy template, and I wanted to highlight, you're seeing a document, I'm highlighting a paragraph. Do you all see that? Those that are viewing it?
Yes.
Okay. So there's three primary purposes there that are bulleted that this annex is to cover, is identifying the experts and specialized resources that exist within the state of Arizona for the Healthcare Coalition. Secondly is the mechanism and process that will be used to determine which patients go to which facilities, either directly in a large-scale disaster or as a redistribution and transfer. And then thirdly is an understanding of how many children each facility is capable of receiving in a surge situation. And then why this is probably is important is we got relatively, compared to pediatrics, we got plenty of adult beds, but the pediatrics not so much, literally with hospitals that don't even have pediatric services. So let me just change the page. How do I unshare and then share something else? I'm sharing. there it is. Sorry. I'm sharing. Okay. And then I appreciate your patience. What you should now see is it's just the outline. I just put it up there just to kind of skim through. It's the areas that we're looking at covering. So you see an outline. It says Appendix A, Healthcare Coalition, Pediatric Surge Annex. Yes?
You can see it.
Okay, thanks.
Yes.
You know, it goes through basic things, purpose, scope, and such, but we'll look at concepts, operations, activation, some special areas in terms of, as you can see there, behavioral health through security and child protection. Down here, which is key in terms of operations related to transportation. One of the things I was asking of Julia, and she sent me the references, was what's the required pediatric equipment on all ambulances, just so I can include that in there. This would end up being a reference as well as an operational piece to their response plan to coordinate primarily hospital resources in this situation. But it, of course, will require work with our partners in EMS to accomplish that. Tracking and reunification is the other key thing in terms of where we send kids and how their family members either stay connected with them or reconnect with them, all the way through providing some appendices with additional information. But that about covers it. That's why I wanted to join your call today. Would there be any questions about the projects or where you could participate? Okay, well,
David, this is Dale, and just to clarify, is the initial goal to survey what the resources and processes are in place currently, or to establish guidelines that what would apply? You know, because I could see so much variation depending on, you know, the geographic barriers, the regionality of the state. Is this guidelines going forward, or just kind of a survey of what we currently have?
The reality is, given the timeline, is we're first coming up with guidelines. There will be an element to want to survey actual capabilities of hospitals and their ability to do surge for pediatrics. And also, I imagine at some point, along with EMS transport, getting a feel for what that capability is if it was a very large scale disaster. The other element this runs into is, as I'm working on the 5-state project under RAPM, is also connecting the Arizona plan then to a larger regional when we get around to even whether or not we would have to transfer patients out of state or receive patients from an adjoining state. Does that answer your question?
It does. It does. It's noble work.
So, like, you know, if I had somebody, you know, in an area, worked in an area of behavioral health, I'm looking for input for, you know, guidance in terms of what considerations for pediatric patients in this type of scenario to be as guidance for dealing with certain parts of that behavioral health element, and so on and so forth, as you saw as part of the outline. The other one is when we're working to finish a draft, we're on a really tight timeline because they didn't get us started till January, and it's got to be done. Quite frankly, I got working. We need to have our first draft next week, and I'll share that with Julia, and she can pass it around. Just we'll be looking for general input, but along your lines of your question, it'll be looking just for guidance and also references and resources in terms to include in the plan for to point people in the right direction for additional information.
Great. Thank you.
Thank you.
Will you?
Thanks, David.
Just a quick question. Will you guys be sending out a survey of what you're looking for to the hospitals?
So yes, eventually, what I'm trying to do, there's two things, a couple of things going on. One, EM Resource already has you do bed polls. If you're with a hospital, maybe you're familiar with that. I think they're doing them these days right now for COVID, where you put up the number of beds that you have available. What we're going to want to do is survey more in depth, let's say in pediatrics, the type of pediatric beds, ICU, PICU, NICU, in more detail that's your total capability, and also capability in a surge, meaning, well, if we need you to take 20% more than you're actually licensed for, let's say, do you have that capability or not? So yeah, at some point we would be surveying that, so we have a matrix of that capability. It would be static, but at least it's a starting point in terms of planning.
Okay, thank you.
Okay, thanks.
Thanks, David. That was helpful.
Thank you again.
Okay, Dale, back to you.
Okay, yeah. So I'm on track with the agenda, and we wish Anne the best. Again, she had to she wasn't able to join us due to a family emergency, and I hope everything's going well with her. That brings us down to item number 6 to discuss action items, and to now essentially go over our past minutes. And if you haven't already seen those, Julia, maybe you can scroll through them slowly so people can take a look. And holler out if you want her to scroll differently or slower. If I could, to the group parliamentary, have a motion to review these minutes. Anybody?
This is Dieters. I so move that the minutes be reviewed.
And then a second, please. Anybody want to second that?
This is Jackie. I'll second.
Thank you. Does anyone have any edits to our meetings? Okay, if I hear no edits, that I would want to hear a confirmation that we will accept and record our minutes from our last meeting. Everybody in favor say aye.
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 Right, is anyone opposed to accepting these minutes in their current form? Okay, thank you. The minutes of our last meeting are accepted, and then we'll be reviewing these minutes at our next meeting. Thank you all for that. Julia, did you want to do the last item to discuss the Pediatric Emergency Care Coordinator role and the performance measure through HRSA?
Sure. So we discussed this at the last meeting, but because there are so many new individuals on the committee, I just wanted to discuss it again. We did not come to a final decision last time, and I think this will be kind of an ongoing project as we decide what it will look like, and then also as we get the results back from the national survey, that will be helpful in kind of getting a picture of what exactly or how many agencies have pediatric emergency care coordinators, if any agencies have them, what they look like if they do, et cetera. I also realized it would have been good to, again, go over our performance measures, but I'll send those out for the group just so any new individuals can kind of know what we're talking about and what we're kind of working from when we're talking about EMS for Children projects. But essentially, Pediatric Emergency Care Coordinator is one of the performance measures for the National EMS for Children project. And at the last meeting, we had looked at a document kind of proposing what a pediatric emergency care coordinator might look like in Arizona, and had discussed including words that are specific to Arizona EMTs or Arizona EMS agencies. So I just kind of wanted to update you on that and then discuss if anybody had any questions or anything along those lines. So if you wanted to look at this document and then just for a minute, and then we can talk again. But just to kind of update everybody, if you're not familiar with the term, a pediatric emergency care coordinator is an individual that can be at an EMS agency or at a base hospital or at the regional level who's kind of responsible for coordinating pediatric specific education, equipment, and things like that for an EMS agency. So the idea is that every EMS agency would have an individual. It doesn't have to be somebody that's a full-time pediatric coordinator, but just somebody designated to promoting pediatric education, et cetera, for an agency.
Julia, I know that FMC does have a pediatric care coordinator that oversees the special care nursery and peds and PICU, but I'm not sure about the EMS in our area. Would you like me to reach out to those providers?
Sure. Yeah, it's helpful to know any information about what's kind of going on currently so that we can get a better sense of what would work for Arizona.
Yeah, and reflecting on that, and just kind of repeating something Julie had already said was the definition of a PEC through HRSA is pretty loose. You know, that individual who is the coordinator for critical care could also wear both hats, to be honest with you, and it's not disciplinary specific. It could be an EMT, paramedic, nurse or physician, or an APP. The idea is to have a person who has a knowledge set that is able to assist EMS agencies with those protocols and resources and stocking to be pediatric prepared. There's not a one size fits all. It's going to be very much tailored to individual area needs. Again, all in that premise of regionalization of pediatric care. So this is a performance measure. Our EMSC program here in Arizona is a component of the state partnership with HRSA. And HRSA is that funding body. HRSA has a goal of 2026 to have 90% of the regions in all states have a pediatric coordinator. Julia mentioned briefly her survey that she's trying to get people to respond fully on, and that will actually give us some information about what regions do have a PEC, and we'll be able to report out how Arizona is doing in that role, and then can try to further reach out to have better penetration throughout the state of Arizona. So it's all noble work. Any other comments or questions about the role of a pediatric emergency care coordinator? Okay. Well, I think the last thing I wanted to touch on before we had a call for open input was the fact that again, this is our third meeting post reorganization, and we're looking to be useful to the Bureau and the other committees. Again, the title of our group is Pediatric Advisory Committee. So we're looking for more projects. I think the safe sleeping one is well underway that we need to keep working on diligently. But we're looking for more ideas from our members, something that would help at your own institution, your own region, and it may be disaster related. David, you may find some information out and a small project that PACES could help with. It's things like that that I would encourage all of our participants to brainstorm and bring to us, and then we'll in turn keep you busy on projects.
I had another idea. I know Juliana and I have been working on cards for like car seats, but a different idea for pediatric disaster preparedness. I guess the Red Cross used to do something where they would make pillowcases, and on the pillowcases it would have items listed that in case your house was on fire or you had to leave your house immediately, then you would have these items listed on the pillowcase to put inside of it. So like a change of clothes, medications, just different things like that. And then the children were given these pillowcases, you know, from the Red Cross or whatever. And so they would have something that A, they could carry that isn't too big, and B, what they should be putting in there. So I think that might be a good project at some point.
Okay, yeah, thank you for that. I mean, you know, it's always nice to not have to reinvent the wheel. If there's some documentation on that or modeling off of what the Red Cross had done, maybe you can share that with Julia, who can share it through the group. Funding would have to be something that we would need to look for if we're going to actually supply those and create them. But it's a kind of a go bag idea. Seems an interesting idea.
Yeah, thanks, Gretchen, for that. I did forget to.
I don't know. I
forgot to include the car seat stickers in the update. But do you want to speak to the group about that?
So, I mean, I don't know much more than what we talked about last time, but we had talked about that when children are in a car that's in the car accident, potentially the parents are, you know, they've had a loss of consciousness or died on scene, and these children, if they're restrained in a car seat, EMS providers don't know their name or who to reach, just in case the parents aren't able to talk at the time. So we were talking about doing a card or a sticker that can be placed on car seats that will have the child's date of birth, if they have any allergies, if they take any medications, potentially like a next of kin to call, like an aunt or uncle, and the child's like nickname. So EMS providers right away can say, "Hi, Johnny, we're going to take care of you." So it's more reassuring to the pediatric patient. So that's what we've discussed. Do you want to add to that, Julia? I'm sorry.
Yeah, thank you. No, that's perfect. So Gretchen and I have been working on that project, so that will be something that we'll have to share with the group soon. Does anybody else have any kind of ideas or things that you've been wanting to work on in terms of pediatric or needed support on?
Hi, this is Jordana. I'm a parent representative, and I just had a question about your sticker for the car seats. As a special needs parent, there are things out there that we have for the little straps that go on the car seats that say for emergency personnel, and it has information inside of those comfort straps that has all medication information, surgeries, if they're nonverbal, if they have seizures, stuff like that. So at a glance, you can just pull that pad off and have all the information on the inside of it.
Awesome. Would that be something that you would be willing to share information on with the group? Or you could send me and I can kind of look at it. That would be awesome. Thank you.
This is Kim Choppy. Please reach out to Yomi because I think she has additional information on what you're looking for.
Yeah, I did actually reach out to her, and She had minimal information and said we had the green light to go ahead on working on that. I think she was looking into whether in Tucson anybody had something similar and maybe a fire station had something. But beyond that, she doesn't have any specific information. Thank you. Okay. So back to the agenda. Do you want to continue with the agenda, Dale?
Yes, please. Agenda items, I think we're just at a call to the public. Am I missing some? Julia, help me out here. Am I missing anything else? I think we're.
No, that's good.
Is there anything else that anybody else wanted to bring up and discuss before we hang up? We'll let everybody go earlier than we anticipated. Okay. Well, this is a quarterly meeting, so we will send out an announcement for our next meeting. And I do appreciate everybody's time.
Thank you. Thanks everybody for joining.
Thank you.
Thank you.
Bye.
Good afternoon, everybody.
Everybody be safe.